Wellness, Homelessness, and Mental Illness by Sandra DeLosa. Wellness includes being in a positive state of physical, emotional, and social condition, but also includes actively striving towards a healthy life. The 8 dimensions of wellness include occupational, emotional, spiritual, environmental, physical, financial, social, and intellectual. This motto believes that each dimension is related and that one cannot reach ultimate wellness until they are able to understand and maintain each one individually. Many people view wellness in different ways based on culture, values, or family beliefs. Someone might believe they have reached wellness in a certain way, but this could be very different from what their neighbor believes. History and humanities also play a role on wellness. This can include the history of vaccines, yoga, meditation, vitamins, or financial crisis history. Each work of art or history has played a role in the way many view wellness, and these can have a positive or negative impact on wellness. Wellness is viewed and achieved in many different ways. Although we know the importance of wellness, many people still partake in unhealthy activities. This includes obesity, tobacco or drug use, or unhealthy relationships. The social force to change can take time, and most will not realize the need until their wellness wheel is no longer balanced. Social force to change also needs to come from the local community in order to help change the negative behavior impacting wellness that is taking place within the community. Working in the human service field can impact the wellness of others. Psychology plays a role in many areas of wellness and how it can positively affect a person's wellness that is receiving services from a social service agency. The social service agency or worker responds to many issues that impact wellness, such as managing infectious disease threats and access to clean water, to therapy and care assistance, such as grief counseling, and assisting with new placements in mental health and long-term care facilities. A person's wellness can also be affected by the emerging technology. This includes vaccines, security, financial education, social connections, or health and fitness. In 2014, over 5 million Americans were reported homeless. Despite the national effort to end homelessness, millions of people continue to struggle and fight for their basic needs to survive, which negatively impacts their wellness. Along with homelessness, many people also struggle with a mental illness, and often these two issues coincide. More than half of the million of Americans facing homelessness also have a mental health diagnosis. Homelessness and mental illness impact each dimension of wellness by the following. Social supports might not be in place. Physical, basic needs are not being met. Financial, struggling with money or lack of income. Spiritual, loss of connection. Occupational, hard time holding or finding a job due to mental illness or homelessness. Emotional, mental health struggles. Intellectual, could be affected by mental health. And environmental, often living somewhere not fit for human habitation. I currently work at a homeless prevention agency and asked a client who recently came into the office if I could ask him a few questions. He reported to me that he has been homeless for the past 6 months and living in his car. He also reported to me that he has been diagnosed with many mental health issues and is currently seeking services, but the wait list to get in is about 2 months long. I asked this client how he thought his wellness had been affected because of his homelessness. He stated that he is nowhere near being well in any dimension, as his basic need for shelter is not being met, he has no income, and he also has many mental health episodes. This client reported to me that he was unaware of how to get connected to services other than mental health treatment. He didn't know where to find housing, and luckily, my agency was able to connect him to the local shelter to hopefully start the process of improving his wellness and finding him permanent housing and supportive services. What steps can we take to reduce homelessness for those struggling with a mental illness and increase their wellness? We can start by educating communities on what homeless and mental illness is. Many people believe that those who are homeless chose to be there, are homeless due to poor choices or drug use. The negative stigma on homelessness and mental illness is so bad that it often interferes with people seeking services as they fear judgment. We can also look at homeless prevention agencies. Many agencies with a mission to prevent homelessness only accept individuals who are housing ready. This means that individuals must have been treated for mental illness and substance abuse before they are eligible for housing. This does not help when the individual struggling with homelessness and mental illness is not already connected and receiving services. How can we decrease homelessness and increase wellness in individuals facing homelessness and also suffer with a mental illness? Challenges that those suffering with a mental illness might face include stigma, no social support, wait lists, or poor follow through. Working towards decreasing these barriers for those suffering can help individuals seek services and homeless assistance that they require. There are many services already available for those who are suffering. Reaching the client, having services more readily available, and taking proactive steps can increase wellness for those in the homeless system. We can also work towards actively engaging the client in their own help. A social service agency can help a client move from the crisis into more stable, supportive housing or treatment. Mental illness and homelessness do not discriminate. Women, men, and children all suffer from the effects of homelessness, and therefore their wellness is impacted in a negative way. As communities and human service workers, we need to make services easier to access, create more shelter space, and offer easy access to mental health counseling and case management services. Everyone deserves housing, mental health treatment, and a positive wellness in every 8 dimensions.